Most people look at their blood pressure reading, see two numbers on the screen, and immediately feel confused. They may know the numbers are high or normal, but they do not truly understand which number is warning them first, which number is more dangerous for their age, and which one needs urgent attention before it quietly causes damage. That confusion is not your fault. For years, many people were simply told, your blood pressure is high, then given medicine or general advice like, eat better, walk more, reduce salt, and manage stress. But very few were ever taught what the top number means, what the bottom number means, and why both are not telling the same story. Imagine this. 1 week from now, you sit calmly, place the blood pressure cuff on your arm, press the button, and for the first time, you actually understand what those numbers are saying. You do not just see 140/90 or 130/80. You see a message from your arteries, your heart, and your blood vessels. You know which number matters more for your age. You know what lifestyle changes target that number directly. And most importantly, you know when lifestyle changes are not enough and medical guidance becomes necessary. That is what we are going to build here. A clear, practical system for understanding blood pressure. Not random tips, not fear, not confusing medical language. A simple framework that helps you know what your body is trying to tell you. Let's begin with the basics. When your heart beats, it contracts and pushes blood through your arteries. That push creates pressure. The highest pressure during that heartbeat is called systolic pressure. This is the top number in your reading. Then your heart relaxes between beats. During this resting moment, the pressure inside your arteries drops. That lower pressure is called diastolic pressure. This is the bottom number. So, when you see a reading like 120/80, the top number tells you the pressure when your heart is actively pumping. The bottom number tells you the pressure when your heart is resting between beats. Two numbers, two different moments, two different meanings. And this is where many people make a serious mistake. They treat both numbers as if they are equally important in every situation, but they are not. Your age, your artery health, your stress level, your sleep, your activity, and your medical history all change. Which number deserves more attention? Before you do anything else, here is one simple step you can take today. Measure your blood pressure 3 times in a row. Sit quietly first. Rest for a minute between each reading. Then write down both numbers each time and calculate the average. That average is far more useful than one random reading taken when you were tired, stressed, rushed, or half asleep. One reading can mislead you. 3 readings give you a better picture. Now think about what those 2 numbers represent. The top number is about force. It shows how much pressure your heart creates when it pumps blood forward. The bottom number is about recovery. It shows how much pressure remains in your arteries when your heart is supposed to be resting. This means your blood pressure is not just one signal. It is 2 signals happening at the same time. And once you understand that, everything changes. Because after a certain age, the top number often becomes the bigger warning sign. But in younger adults, the bottom number can sometimes reveal the deeper problem first. In the next part, we will break down the top number, why it rises with age, and how stiff arteries can silently push your systolic pressure higher year after year. Now, let's talk about the top number, systolic pressure. After the age of 50, one of the biggest reasons this number rises is arterial stiffness. Your arteries are not supposed to be hard pipes. They are designed to stretch and relax with every heartbeat. When your heart pumps blood forward, healthy arteries expand slightly to absorb that force. Then they gently recoil to keep blood moving smoothly. But over time, those arteries can lose flexibility. The soft, elastic fibers inside the artery wall begin to weaken. They are gradually replaced by stiffer tissue. Instead of acting like a flexible hose, the artery begins to behave more like an old, rigid pipe. When that happens, every heartbeat creates a stronger pressure spike. The artery cannot expand properly, so the force has nowhere to go. As a result, the systolic number climbs. This is why many people over 60 may see something like 155/78. The bottom number may look acceptable, but the top number is still dangerous. That high systolic pressure means the heart is pushing blood into a system that has lost some of its natural flexibility. And this matters because elevated systolic pressure is strongly linked with higher risk of heart attack, stroke, kidney strain, and damage to blood vessels. The top number is not just normal aging. It is a signal that your arteries need attention. So what can help? The first powerful tool is potassium-rich food. Potassium helps blood vessels relax. When your blood vessels relax, pressure can come down naturally. Good sources include avocado, sweet potato, white beans, spinach, bananas, salmon, sardines, and lentils. For example, one medium sweet potato gives more than 500 milligrams of potassium. 1 cup of cooked white beans can give over 1,000 milligrams. These are simple foods, but most people do not eat enough of them consistently. The second tool is regular aerobic movement. Walking, cycling, swimming, or any steady movement that raises your breathing can help restore some flexibility in your blood vessels. You do not need extreme exercise. You need consistency. A good target is 30 minutes of moderate movement, 5 days a week. Moderate means you are breathing harder, but you can still speak in short sentences. That is the zone where your heart and arteries begin to adapt. Think of your arteries like a garden hose. A new hose bends easily and springs back into shape, but a hose left in the sun for years becomes stiff and cracked. Your arteries can go through a similar change when they are exposed to years of stress, poor sleep, low activity, high blood sugar, and poor nutrition. But here is the hopeful part. Arterial stiffness is not always a one-way road. With regular movement, better food choices, and consistent habits, many people can improve how their arteries function. You may not reverse decades overnight, but you can begin moving in the right direction. And the top number often responds when the arteries become more relaxed and flexible. But blood pressure is not only about the top number. The bottom number tells a very different story. And for many people under 50, it may be the more important warning sign. In the next part, we will look at diastolic pressure, why it stays high, and how stress and poor sleep can keep your arteries under pressure even when your heart is resting. Now, let's shift your focus to the bottom number, diastolic pressure. This is where most people underestimate the real problem, especially if they are under the age of 50. While the top number gets most of the attention, the bottom number quietly reflects what is happening in your body when your heart is supposed to be at rest. Diastolic pressure measures the force inside your arteries between heartbeats, during the phase when your heart relaxes and refills with blood. This is your recovery phase. Ideally, your arteries should also relax during this time. The pressure should drop, giving your vascular system a chance to decompress before the next heartbeat. But when your diastolic pressure is consistently high, that decompression never fully happens. Your arteries stay under constant tension. Even when your heart is resting, your blood vessels remain partially constricted, as if your body is always in a state of mild alert. This continuous pressure may not cause immediate symptoms. You might feel completely normal, no pain, no discomfort, no obvious warning signs. But inside your body, something important is happening. Your blood vessels are being exposed to ongoing mechanical stress. Think of it like bending a thin metal wire back and forth. One bend does nothing. 10 bends still seem harmless. But repeat that action thousands of times, and eventually the wire weakens. It loses strength and becomes more likely to break. Your arteries respond in a similar way when they are exposed to constant pressure without proper relaxation. Over time, this persistent stress can weaken the inner layers of your blood vessels. One of the most serious risks linked to long-term elevated diastolic pressure is the development of an abdominal aortic aneurysm. This is a condition where a weakened section of the aorta, the largest artery in your body, begins to bulge outward. What makes this dangerous is how silent it is. In most cases, there are no clear symptoms. A person can carry this condition for years without knowing, and if that weakened area ruptures, it becomes a life-threatening emergency with very low survival rates, even with immediate medical care. This is why the bottom number cannot be ignored, especially in younger adults. High diastolic pressure means your vascular system is not getting the rest it needs. So what drives this constant pressure? One of the biggest contributors is chronic stress. Not the sudden short-term stress that comes and goes, but the low-level, ongoing stress that becomes part of daily life. Work pressure, financial concerns, lack of downtime, mental overload. All of these keep your nervous system in a heightened state. When your body stays in this state, your sympathetic nervous system remains active. This is the system responsible for the fight or flight response. When it is constantly turned on, your blood vessels stay slightly tightened. That tightening increases resistance in your arteries, which pushes your diastolic number higher. And here is the key point many people miss. This can happen even if your diet is good and you exercise regularly. Stress alone can raise your baseline pressure by several points, and when that pressure stays elevated for years, the impact becomes significant. Another major factor is sleep. Sleep is not just rest for your mind. It is a critical recovery window for your cardiovascular system. During deep sleep, your parasympathetic nervous system becomes dominant. This is the rest and repair mode, where your heart rate slows, your blood vessels relax, and your body resets its internal balance. If you consistently sleep less than 6 hours, you reduce this recovery window. Your body spends more time in a stressed state and less time in a relaxed state. Over time, this imbalance keeps your diastolic pressure elevated around the clock. Studies have shown that people who sleep less than 6 hours regularly tend to have higher diastolic readings compared to those who get 7 to 9 hours. The difference may seem small at first, but when multiplied over years, it creates a meaningful strain on the vascular system. So what can you do to directly influence the bottom number? Start with deliberate nervous system relaxation. This is not about complicated techniques. It is about giving your body a clear signal every day that it is safe to relax. Slow breathing is one of the simplest and most effective methods. Breathing in for 4 seconds and out for 6 seconds for several minutes can begin to shift your body from a stress-dominant state to a recovery state. A quiet walk without distractions can have a similar effect. Sitting in stillness, reducing screen exposure before bed, and creating a calm evening routine all support the same physiological shift. The goal is to activate your parasympathetic system consistently, not occasionally. Then, protect your sleep. Aim for 7 to 9 hours each night. Treat sleep as a priority, not an afterthought. Your arteries depend on those hours to reset their tone, reduce inflammation, and maintain proper function. When you combine stress reduction with proper sleep, you are directly targeting the root causes of elevated diastolic pressure. You are not just lowering a number. You are restoring balance to the system that controls that number. Now that you understand both the top and bottom numbers, the next step is to connect them, because there is one critical factor that determines which number should be your main focus right now. And once you understand that factor, your entire approach to blood pressure becomes clear and far more effective. Now, let's bring everything together, because this is the moment where most people finally understand what actually matters for their situation. You now know that the top number, systolic pressure, reflects the force your heart generates when it pushes blood through your arteries. And you know that the bottom number, diastolic pressure, reflects how much pressure remains when your heart is resting. One is about effort. The other is about recovery. But here is the key piece most people never hear, clearly explained. The number that matters most for you right now depends heavily on your age. If you are under 50, elevated diastolic pressure is often the bigger concern. At this stage of life, your arteries are still relatively flexible. They still have natural elasticity. But if your diastolic number is high, it means your blood vessels are being exposed to constant pressure without proper relaxation. The system is being overworked, not necessarily hardened yet, but strained. That continuous strain can slowly weaken your vascular structure. Over time, it increases the risk of damage from the inside out. This is why younger adults with high diastolic pressure need to take it seriously, even if the systolic number looks acceptable. Now shift to the other side. If you are over 50, the situation changes. The primary concern becomes systolic pressure. Your arteries have naturally lost some flexibility over the years. This is part of aging, but it is heavily influenced by how you live. When those arteries stiffen, every heartbeat sends a stronger pressure wave through a system that cannot absorb it as efficiently. That is why the top number becomes more important in midlife and beyond. Elevated systolic pressure in this age group is strongly linked to heart attack, stroke, and long-term organ damage. It is no longer just a number. It becomes a predictor of real cardiovascular events. For many years, medical thinking focused more on diastolic pressure. Doctors believed the bottom number was the primary risk. High systolic pressure in older adults was often seen as a normal part of aging, something to watch but not aggressively treat. That understanding has completely changed. Large, long-term studies have shown that systolic pressure is a stronger predictor of cardiovascular risk in people over 50. As a result, modern guidelines now prioritize controlling the top number in older adults, not because the bottom number stopped mattering, but because the top number became a more accurate signal of danger. So now, you have clarity. Under 50, protect your bottom number. Reduce constant pressure on your arteries. Focus on stress control and sleep quality. Over 50, prioritize your top number. Improve arterial flexibility. Focus on movement and potassium-rich foods. This is not guesswork. This is a targeted approach based on how your body changes over time. Now let's talk about something important that many people wonder about: medication. If you are currently taking blood pressure medication, it is important to understand what it does and what it does not do. Medications like ACE inhibitors, beta blockers, calcium channel blockers, and diuretics are effective. They lower your numbers. They reduce risk. For many people, they are necessary and life-saving tools. But medication is not the full solution. Even when blood pressure is controlled with medication, studies show that the overall cardiovascular risk is still higher compared to someone who has never had hypertension. In simple terms, medication helps manage the outcome, but it does not fully correct the underlying system. This is where lifestyle comes in. The 4 inputs we discussed: potassium intake, consistent aerobic movement, stress management, and proper sleep, directly influence the system that creates your blood pressure in the first place. Medication and lifestyle are not competing strategies. They work best when combined. If you rely only on medication without changing daily habits, you are controlling the numbers while the root causes continue to push those numbers upward. But when you combine both, you begin to close that gap between controlled and truly healthy. Now imagine applying this in real life. You wake up and include 1 potassium-rich food in your morning routine. Something simple, like a banana, avocado, or spinach. During the day, you move your body for 20 to 30 minutes at a steady, moderate pace. In the evening, you give your nervous system time to slow down, stepping away from constant stimulation. And at night, you protect your sleep as if it is part of your treatment, not just rest. This is not a complicated system, but it requires consistency. And consistency is what most people struggle with, not because it is difficult, but because they do not see immediate results. Blood pressure responds over weeks and months, not overnight. But when the change comes, it is measurable and meaningful. Now, before we move to the final part, there is one critical mistake that even disciplined people make when they start improving their blood pressure. They see improvement and they stop paying attention. In the next part, I will show you why that mistake can quietly undo everything when lifestyle changes are not enough on their own, and how to build a simple monitoring system that keeps you on track long term. Now let's talk about the mistake that quietly undoes progress for a lot of people, even those who are disciplined and doing everything right. You learn the system, you start eating better, you move more, you manage stress, you sleep properly. After a few weeks or a couple of months, your numbers improve, and then something subtle happens. You stop checking. That is where the problem begins. Without consistent measurement, you lose your feedback loop. You no longer know whether your blood pressure is continuing to improve, holding steady, or slowly creeping back up again. You are operating without data, and in something as important as cardiovascular health, that is a risk you do not want to take. Blood pressure is not static. It responds to your habits, your stress levels, your sleep quality, your diet, and even seasonal changes. What worked 3 months ago may need adjustment today. Without regular monitoring, you have no way of knowing. Think of it like driving a car without a dashboard. You may feel like everything is fine, but you cannot see your speed, your fuel level, or any warning signals. Eventually, that lack of information catches up with you. So here is a simple rule that changes everything. Measure your blood pressure at least once a week, same time of day, after sitting quietly for 5 minutes. Take 2 or 3 readings and average them. Then write those numbers down. That record becomes your personal data. It tells you whether your efforts are working, it shows trends over time, and it gives you something objective to discuss with your doctor if needed. Now, there is another reality you need to understand clearly. For many people, lifestyle changes alone will not be enough to bring blood pressure into the optimal range. That does not mean the effort is wasted. It means your body may need additional support. There are 3 situations where you should not rely on lifestyle changes alone. First, if your systolic pressure is consistently above 160, at that level, the strain on your cardiovascular system is significant. Waiting for gradual improvement through lifestyle alone may not be safe enough or fast enough. This is where medical guidance becomes essential. Second, if your diastolic pressure is consistently above 100, remember what we discussed earlier. That constant pressure on your arterial walls is happening all the time. The risk is active right now, not something far in the future. This situation needs proper evaluation. Third, if you have existing conditions like diabetes, kidney disease, or a previous heart event, in these cases, your target blood pressure is usually lower than the general population. What may look borderline for someone else could be dangerous for you. Your doctor needs to define your specific target. Ignoring these situations and relying only on lifestyle can lead to a false sense of security. And that is one of the most dangerous positions you can be in, believing you are fine when you are not. Now, let's turn everything we have discussed into a clear daily structure. In the morning, within a couple of hours of waking, include one potassium-rich food. It could be as simple as a banana, a handful of spinach, or a portion of beans. This is not about perfection. It is about consistency. During the day, give your body at least 20 to 30 minutes of steady movement. Walking is enough. You do not need a gym. You do not need intense workouts. You need regular, moderate effort that your body can sustain. In the evening, create space for your nervous system to slow down. Turn off distractions. Step away from constant input. Even 15 to 20 minutes of calm breathing, quiet sitting, or a slow walk can begin to shift your body into recovery mode. At night, protect your sleep. Aim for 7 to 9 hours. Treat it like a non-negotiable part of your health routine, because physiologically, it is one of the most powerful tools you have. These 4 actions, repeated daily, directly influence both numbers in your blood pressure reading. They are simple, but they are not optional if you want long-term results. And remember, this is not about quick fixes. It is about building a system that supports your cardiovascular health every single day. In the final part, I am going to bring everything together in the simplest way possible, so you leave with a clear understanding of what to focus on based on your age, how to think about both numbers moving forward, and how to stay consistent without overcomplicating the process.